Welcome to the CTA Foundation CES interview series. My name is Steve Uhl, and I'm Executive Director of the Consumer Technology Association Foundation. And I'm really pleased to be joined today by Meosky Luo, the founder and CEO of Folia Health. Welcome, Nell. So happy to have you join us at CES this year.
Hey, thanks so much. Yeah, we're really excited about this.
Well, first off, for those that don't know anything about Folia Health, can you share a little bit about the work that you're doing?
Sure. So Folia started a few years ago on the basis of, honestly, my personal experience, that of my co-founder, Dan, and some work that I'd done when I was a student. We realized that people who are living with chronic or complex diseases, anything from Alzheimer's disease to diabetes with neuropathic pain or cystic fibrosis, autoimmune conditions, people in all of these categories have a huge amount of information that they're noticing all the time, right? So I have a younger brother who has a complex illness called CVID. It means that he has trouble fighting off infections on his own, which is, currently a big issue. And when he was growing up, my parents had to figure out, basically what was going on with him, how he was responding to therapy, what was working, what wasn't working, how could they tell when they needed to call the doctor or, when he was getting worse. And so they started to become, real experts in my brother's condition, and they collected a huge amount of information. The tricky part is that information was being captured predominantly in notebooks. My parents have bookshelves worth now, because my brother's in his late 20s, of information on his condition. And my mom can name the one resident who ever read it, right? Because there's no time, and who's going to be able to sit down and read the notebooks? It was never used for research. But then I learned later on, I was doing outcomes research at Yale, and I learned that the problem is also a problem actually for researchers who are looking for information about how these conditions manifest themselves, how they change over time, what works, what doesn't work. And they would love to have the type of information that my parents had been collecting in notebooks that no one had been reading. And so the idea of Folia is to really tap into those individual insights. Our tagline is "Your knowledge matters." And the idea is basically to enable people to capture the knowledge that they have by responding to simple, personalized, multiple choice questions in an app and online, excuse me, and then to be able to share that information with anyone that they need to share it with. So with family members, with their mom, with especially in the case of someone who's elderly, with multiple caregivers, and then also with doctors and researchers who can use that information to be able to both give that individual person better care and to advance the care in that condition.
That's really incredible, because that's been one of the big challenges in healthcare is getting all that information, collecting all that information, but then also, the real challenge is how to use all that information. And you mentioned the fact that, the challenge is the people in the healthcare system, don't have the time to be, reading through all the notes and things
100%.
along those lines. How are you able to then kind of turn this into useful information for both the caregivers, but also kind of the medical professionals that are involved in this?
Yeah, that's a great question. There are a couple of different pieces of it. So the first thing is to figure out what is required or actionable information, right? So one of the major problems that healthcare and a lot of industries have dealt with is kind of this proliferation of data that's meaningless, right? And so it's a lot of data points. A lot of doctors feel like they're being inundated with just lots of information, but until you make it actionable, it's not very useful. And so what we focused on is figuring out, okay, what are the actionable details that someone needs to be able to share? And then how can we make it possible for that to be shared in the most digestible, simple way possible? You might laugh, but what we eventually realized through a lot of iteration is that we really needed to go back to basics. So we developed something that we call the appointment guide. And the appointment guide is a very simple export of the data that you've collected in Folia. And soon, actually this year, it will also include data that you pull in from other sources through a feature we call Zipline, so things like your EHR data. And it's a very simple digest of that information, highlighting where things have changed, right? So that's the most important thing. And then the way that we send it out is in PDF form, which again, we're at CES, right? People, there are much more elegant technological solutions for how to send information. But the reality of it is PDF is highly versatile and is very simple for people to use. And so regardless of whether your provider, is very tech literate and plugged into all sorts of things, or is just someone who, uses paper charts even, or just, uses EHRs at a basic level, everyone can use a PDF. PDFs can be sent through all sorts of mediums. They can be texted, they can be pulled up. I mean, on this Zoom call that we're having, I can pull up a PDF. So that's what we landed on, which sounds nuts, but actually seems like it's the best way to transfer this information at this point.
Yeah, well, if the technology isn't going to be used, it's not going to be helpful. So It really is finding that solution and that kind of technology that is going to be able to get the information to the people in the most useful form possible. So yeah, whether it's a PDF or some other solution, whatever works, that I'm a big believer in that. So that's really incredible. So now, it sounds like you're going essentially kind of direct to consumer, or are you working with like assisted living communities, or, what's kind of your business model for the solution?
Yeah, so we kind of have a marketplace type of model where people can use Folia totally for free. And the way that we support the business is, and support the fact people are using it for free, is to then do research programs that people can send into. And so the way that works is that we work with people who are developing new therapies. So like, small experimental pharma companies, sometimes pharma manufacturers, larger pharma companies, academics and foundations who are, basically trying to learn more about these conditions and how to treat them. And we run research programs that users can opt into. Some of these research programs are like super high level. So it's, I want to learn more about, sickle cell disease. And so I just want to do a broad survey to see, over a year, what are people tracking? What are people noticing? Or they could be really targeted to a specific therapy, to a specific question that the researcher is trying to answer. And then when people opt in to having their data shared through this kind of marketplace model, they then receive data dividends back. So data dividends is a program that we're really proud of. We're pretty sure it's the first in our space. And basically the way it works is it's literally revenue share with individuals who are capturing and sharing this data for research.
That really is interesting because, yeah, I mean, I would imagine, especially for some conditions that are a bit rarer and harder to collect information in there, being able to have that data set out there and have access to people who are experiencing those conditions. I can see how important that would be to the researchers in developing new solutions and services as well. So that's really, really cool. I know you've been part of the AARP Innovations Lab's startup portfolio. Can you talk a little bit about your experience and your work with AARP Innovation Labs?
Yeah, well, AARP has been an awesome partner. They're actually one of the first organizations we ever partnered with. A couple of years ago, we were part of the Mass Challenge Health Tech cohort, and we were paired with AARP, so that's how we first met them. And Andy and his team have been just the definition of champions. They are helpful in all of the ways they need to be helpful. They like step back and, let us kind of tell them the types of things that we need to be able to be successful. One of the things that they helped us with was doing focus groups. So being able to understand how people in a 50+ age category would use Folia, both as patients and as caregivers, understanding what are the types of things that are most useful, what are the types of things we might want to update in the app. So for instance, contrast, right? Like not high enough contrast between images, things like that. And we learned a lot about how to be successful in those older age groups from that project that they spearheaded for us. Which was great. And now going forward, we're really excited to be working with them on a couple of different initiatives that we'll be launching this year.
Well, that's great. Very exciting. I can't wait to hear more about what's coming. And, speaking of what's coming, here we are at CES 2021 digitally this year, but we're going to be hearing throughout the week about, some of the technologies that are launching this year. We're also going to have lots of conversations about, what are the technologies coming in the next, 3, 5, 10 years that
Right.
will impact, all of us in beneficial ways. It doesn't have to be Folia related, but, are there emerging technologies that you're excited about or that you're following?
Yes. I will tell you I'm pretty nerdy about healthcare stuff. And I have 6 younger siblings who think I'm like way too much out of touch with things. I'm not that old and probably don't have a great excuse, but healthcare focused is kind of how I often am. So one of the things I'm really excited about, this is going to sound crazy, is I've been talking with this scientist who developed a toilet seat that has kind of multiple functions to be able to do biometric screening, including, obviously there's like stool sampling, stuff like that, but blood pressure monitoring for people with heart failure, because your femoral arteries in your legs are actually pretty good sources of information for blood pressure. And you're sitting on the toilet and it can get that measurement. So I think that's awesome. I remember when I was a kid going to Epcot and there was this basically like bathroom of the future display that was like, these are all the things that we'll be able to see if you're at high risk of cancer, because we'll be able to do, internal body temperature screening while you take a shower. And those types of things I think are really awesome. And I love this idea of being able to have a much better complete set of individual information on your health. I think that's going to be key to making sure that people are not only treated when there's something wrong, but that we're catching things, that we're preventing, progression of disease.
Well, that sounds like a really incredible product and really an exciting area. And certainly we're going to see a lot of conversation around digital health. And I think it's interesting to see, what are the various, wearable devices, smart home products, other kinds of, the sensors that can all kind of tie together and quantify information about ourselves, about our loved ones, but also provide the right balance between the security and health that information provide 100%. With the privacy then.
Yes, that's the huge caveat, right? And it's I will say on the far side of the spectrum, I've also heard of smart pills that basically can track whether they've been used or not by the patient. And I can't make this stuff up. They were tested in schizophrenia patients, which seems like a very bad first test case, since it would make anyone feel nervous. So I would say definitely there are bounds, right? And we have to think about like what is reasonable, and also how are individuals being put in the driver's seat. If anyone's really interested in this topic, our head of growth, Christina, is really into this, and she has written a series of posts on our website that talk about like, how can people be more in charge of their own health data and privacy? But I think we're just scratching the surface on that. I think people need to have a very clear idea of where their information is going. And frankly, the default needs to be that they own it until they opt in otherwise, I think.
Yeah, and I think I'm going to have to look all that up and read some of those articles, because I do think it's a really important conversation to have. But I think that's also where the model that you've created is so interesting, because you're able to create those digital dividends that can help compensate people if they do want to share that information, and gives them control over that information as well. So I think that's a really exciting conversation that we're going to have going forward, really across the technology spectrum, but giving people the power to control that information, while also the power that having the information can provide them. I think it's such an important piece. So really excited to see the work that you're doing in this space. If people are interested in learning more about Folia Health and maybe signing up themselves, where should they go to get more information?
Yeah, we'd love to have you. People are using Folia for something like 250 different conditions, so including undiagnosed conditions. So however weird you think you might be, you can use Folia. And they can go to our website, which is just Folia Health, FOLIA health.com. And there's a big button that says sign up, and you can also read more about us, see a really beautiful video of my co-founder Dan and his daughter. And if you have any questions, or if you want to talk to our team, we do have people who are available to talk to you about all these different questions. Longer than normal business hours, not at 1 a.m. Eastern, but pretty close.
Oh, that's great. And I encourage people to check it out. And no, it's a real pleasure talking to you and learning more about the technology that you've developed, and really excited to see it continue to grow and reach more and more consumers, and really gather that information that will help us all as we're experiencing different conditions, and hopefully lead to greater opportunities to treat them. So really, thank you so much for joining us here at CES this year.
Yeah, thank you. This has been great, and we're really looking forward to it.
Well, absolutely. Well, for the audience, if you're interested in learning more about the CTA Foundation, you can go to ctafoundation.tech, and I hope you have a wonderful CES 2021.